Hello everybody, welcome to the second of the practice webinars. Last time when we started we looked at the diploma website first of all, and then at the very end we came into looking at images and looking at Snagit. Tonight I'm going to reverse it. I'm going to look at images first of all, and then Snagit, and then we'll look at the website. You don't need a big expensive camera to be in the diploma. You basically need a small compact camera, either a Canon or a Sony. You shouldn't need to spend more than 200, 250 Australian dollars on a good small compact camera. It doesn't have to have 22 megapixel images. The original ones when we started were only 3 megapixels, and in fact most of the images that I in fact take, I only take at around 2 megapixels. But sometimes it's difficult nowadays to get a camera that will in fact do a small image like that. The only bits of advice I'll give you about your camera is set it to automatic and put the macro on, because the biggest problem I have when people submit cases is that they haven't got the image in focus, and the reason they haven't got the image in focus is because they haven't put the macro on. So just routinely have your camera set up in automatic with the macro on. Now some of the newer cameras, they have an easy setting as well, and it'll automatically put it in macro. But just keep it simple, and if you do have the opportunity to have it in automatic with the macro on, just leave it for that, because the macro will work up to 4 or 5 feet away from a patient, and it'll also obviously work very close to a patient. When you're taking images of a patient, I really just need 3. You can give me more than that, but you really just need 3. I need an overview first of the rash, then I need a close-up of a lesion, and I certainly want a close-up of a new lesion if we possibly can. In the system that we have for you submitting your cases, you can put up 6 images. You don't have to put up 6 images. Don't put up 6 images that are exactly the same. Try and get, as I say, a composing view to show me the distribution of the rash, and then a close-up of a lesion and a close-up of a new lesion, because that's where we'll get the most information. So you should put up a minimum of 3 photographs. You can put up a maximum of 6 for any particular case. How do you, okay, say you've got your camera and it's a 14 megapixel camera. Make sure you know how to go in there and reset it. Don't have it taking every image at 14 megapixels. Generally go in and try and have it set for possibly 2 or 3 megapixels. That's as big as you in fact need. And even that is too big if you're going to submit the cases to the virtual clinical meeting. And I'll show you later how you resize an image. It's very simple. The program, you'll initially have your images in the capture card in your camera, and you then have to get your images into your computer. Some of the new cameras have Wi-Fi cards in them, and they'll automatically send the images to a particular file in your computer. But if it doesn't, you basically have to get a card reader, and you take the card out of your camera and put it in the card reader. Now I've got mine in here. Let me just go to this particular area here, and I'll show you where my camera is here. There may be a small delay, by the way, time-wise, depending on the internet speed, between me bringing an image up and you actually seeing it in your screen. Bear with me with that. If that gets really out of sync, I'll slow down. Now, these are some of the images that, these were some that I, in fact, took today. Most of my images you'll see have a patient number, patient's initial, and the diagnosis associated with them. For instance, let's have a look at this one here. I'll wait till that comes up at your end. This was a guy who came in to see me just for a skin check, but he had all this sebaceous tissue. It's almost like rhinophyma. It's like the thickening of sebaceous tissue that you get in rosacea. And he had a degree of rhinophymatous change here too, but he had this round his eyes. You can see the redundant bags he has here, and he's got a bit of hooding here as well. A plastic surgeon would have a rare old time with him tidying him up. Now with ACDC, that's the image size that comes up. You can resize in ACDC by going up to, click in Manage View, going up here to Batch, and just going down to Resize. So if I was wanting to resize that image, because that image at the moment is 1.3 megabytes in size. Now normally, putting images up in the virtual clinical meeting, we normally want to put them up at somewhere in the region of 500 kilobytes, something like that. So if I resize this to roughly about 60% or something, let's just resize that image. That's it done now. Now the resized one always comes at the end here. The original is still there. It doesn't change the original. And if we look at the size of the resized one now, there it's down there. It's 397 kilobytes. And then if we just bring it up on the screen, you can see that there's very little difference in the quality of the image when it's displayed on the computer screen there between one that's 1.3 or 1.4 megabytes in size and one that's virtually a quarter of that, you know, at about 350, 360 kilobytes. So it's very simple to resize an image with ACDC, and you still keep your original image there. How do you name an image? You can batch rename, or you can rename an individual one. Let's take this girl here. Let me just show you her picture here. This was a young girl who came in again for a skin check, but she had all of this pigmentation here on her forehead. Now she thought it was freckling, but when I look at that, that's a most unusual type of freckling, and I think she's really got a type of melasma. That's a hormonal induced type pigmentation. And if we just have a quick look at her other images, you know, that's just a close-up of her forehead. And then if we have a look at her cheek, you know, that's it's quite an interesting pattern of pigmentation. I felt around here just to make sure she didn't have any solar keratosis or anything else like that, because there's a rare condition called xeroderma pigmentosum, where they have a genetic defect in the ability to heal the solar damage in the skin, and they can get, you know, an unusual type of freckling, but they also get a lot of solar keratoses and even skin cancers from a very early age. But she didn't have any sign of that. Anyway, I digress. Let's say we were going to rename that image. You can see it's come in with the name there. That DSC0033 is just the number of it in the camera. Say I'm going to rename these. I just highlight them all like that. Then I go up to Batch and Rename. And then what I normally do in here is I put the patient's case number. I'll need to check hers up, but let's say it was 6756. And then I put the initial, ER, and then I put the diagnosis. I might put melasma and pigmentation. And then I just click Start Rename, and it will automatically rename the four of them for me. And there it's there with the name underneath there. If I want to resize all those four there, I can just highlight them like that again, go up to Batch, and go to Batch Resize. And then just click Start Resize, and it will swiftly resize the four of them, and they'll appear at the end. And you can see now that these four files here, each one would have been about 1.3 megabytes, but the four of them together there is now just 1 megabyte. So each of them are now just 250 kilobytes. So it would be these ones that I would then put up in the clinical meeting. So hold that in your mind for later on, because we'll come back to this later on when I'm going to put this case up in the clinical meeting. So ACDC can do a whole lot of other things. You can view individual ones. You can edit an image just by clicking edit. You can do a variety of things. You can actually resize from in this area here as well if you want. You can crop an area of an image. You can change the color balance. But you know, if you take your photograph properly in the first place, you don't need to do any of those things. I very rarely go in there and have to change any of my images at all. The other thing that ACDC has is this little bit down the bottom here, where it allows you just to play around a little bit with the size of the image. So if I wanted to expand that, I can go like this at the base here, and that will slowly come up on your screen up there. And you can see that's one of the resized images there, and you can still see the quality of it. And it's only 250 kilobytes, that particular image. To move an image around, by the way, you just sort of hold it, click it down here with your the left hand on your mouse, and just move it down. You can move it around in your screen. What I'd recommend you to do is to get a copy of ACDC, capital A, capital C, capital D, and C, S-E-E. You can download it, a free copy for 30 days and play around with it and what have you, and just get a feel for it. And I'd honestly recommend you buy it. It costs about $45, $50 or something like that. And I just find it's an excellent program for manipulating, naming, and editing any images that I want to edit. So that's just a very quick overview of ACDC there. As much as you need to know as far as the diploma is concerned, because that's all you need to do in the diploma. You just need to be able to resize an image and name an image, and then you'll have to upload it to the website, and I'll show you how to do that in a minute. Now, the other program that I wanted to show you is one called Snagit, S-N-A-G-I-T. Again, you can download it free for 30 days. And what does Snagit do? It does a whole lot of things. But what it allows you to do is to capture an image anywhere. Say you have an image that comes up in a PDF file. Say you're looking at a website and there's an image there that you wanted to capture for your own collection. If you can't sort of right-click and save it, then all you do is you just open up Snagit and click on this to capture. Let me just open up an image somewhere first. Let's take this lady's image here. Let me open up this. Now, this is another quick way, by the way, of resizing. Say you had opened up that image in ACDC, or say you had just opened it up on your camera, you know, on the program that came with your camera with the computer. Then you just click to open up Snagit, click here to capture. You'd go up, and if there's just a bit of it you want to capture, you just put it within the crosshairs like that and bring it down like that. And then what will happen is this image then comes up in the editor for Snagit. Let me make that full size for you. Now, what you can do there is, if you wanted to, you can, well, first of all, you can just save it by going to File and Save, or Save As, and save it just in standard JPEG format, because they're all sort of saved as JPEGs. But the other thing you might want to do is you might want to annotate it. You know, if you're doing teaching, and when I'm doing teaching, I may want to annotate. And what you can do there is just go up here to the little arrow, click on the arrow, and get it to point to something that you want it to point to. So let's say we get it to point to that little bit there. And that, let's say that's an excoriated papule. This, by the way, is a lady's buttock. This is a natal cleft. And these are the thickened nodules that you'll get in lichenified eczema. Now, say I wanted to annotate that. I put my little arrow like that. Then I go up to this little bit here that says text, click on that, draw a little square like that, and then I put my text in the middle. And then I can move that around, put it where I want it to go. Let's have it there. And then when I come to save that, it'll save it with the various points annotated in it. You don't need to do it for this particular course, but there's another course that we run with dermatoscopy where we often get people to point out various features in images and annotate them. But if you are ever doing any teaching, this is a very easy way of annotating an image and then saving it. Now, if we're going to save this, let me just save it. I'll save it back in where we were before. I'll back into the computer, back into my image, my card reader, back into where it was. I think we were in 107, weren't we? Now, it automatically, by the way, saves it under that date and timestamp there. You can then change that to whatever the patient's number was. I don't think we had done that patient yet. I can't remember what her number was. It may have been. Let's just save it as that, but put A after it. And just click Save, and it'll automatically save it. So if we now go back to ACDC and look in that particular file again, yeah, here it is here. There's the image that we've just done there. Okay. So the thing about that, let me just show you the size of that image. Does it tell me? What size is it? Yeah, here. It's only about 175 kilobytes. The original image, when it was in the camera, is about 1.3 megabytes. But if you just take a little Snagit capture, Snagit captures of an image are only about 200 kilobytes. So again, that's a very quick way of resizing an image as well, where you just take a Snagit capture of it, and it automatically, it doesn't matter how big the image was when you opened it, when you do a Snagit capture, it comes in just at about 200 kilobytes, and that's an excellent size for uploading to the website. So Snagit does a whole lot of other things as well. You can actually even record little bits of video. You can take text that's in an image, and it will convert it into text in a Word file. So it's a very useful little program, and as I say, it costs about $40 as well. I don't think you'll ever regret buying Snagit. So ACDC and Snagit are about the only two other bits of software that I reckon you might consider buying. Okay, any quick questions on what I've said there so far? Anybody want to make a comment on anything or have a quick question on anything that's been mentioned about ACDC or Snagit or cameras in general? Abbas, let me come to you. Yes, Abbas?
Yeah, I wanted to know what kind of lighting you use for the camera.
I don't use anything. Sony that I use, and it's an old Sony. It must be about 5 years old. I think it's just looking at the front of it here just now. What is it? So it's only 8.1 megapixels. That's the maximum size of the image I can get. It's a Sony CyberShot, and I just set it with the flash on. In general, you're better setting it with the flash on. Usually, it won't wash out. If you take a picture and the flash that comes with these washes the picture out because there's too much light, then just put it off. The camera will compensate. So I don't think you need additional lighting. These ones are taken just with the flash automatically on. I just leave it on all the time where I am. I don't have any special lighting of that at all. And usually you don't need it, honestly. Modern cameras, even the little compacts, will adapt for for the vast majority of lighting situations that you'll have. But generally, you're better just to leave the flash on. And with the CyberShots, it usually gives you the option to have the full flash, or else to have a flash such that the things near you are illuminated more than things in the distance. And that's the setting I usually have it on. And if as I say, it tends to be too bright, then I'll just have it. Sorry, I'll just mute you there. There's just a bit of background noise. I'll just put it off altogether and just use it without the flash. And most modern cameras, will compensate very nicely for that. Any other questions there? No, nothing else on that. So any of the basic compact, Pentax, Olympus, Sony, or the Nikons or the Canons. Generally, we've advised the Canons or the Sonys. They usually have good macros and good color rendition. as well. But the main thing is get the damn thing in focus. Make sure you get your macro on so that at least it's in focus. You know, I want to see the surface like that. I don't want to see all this blurred, or I won't be able to say what it is. Okay, that was the quick talk on AC/DC, cameras, and Snagit that I wanted to give you. Let me just close those down. Let's get into the website now. The diploma course itself is going to be delivered through the My Skin Consult website. You will have already been given usernames and passwords for Student Skin Consult and Skin Consult. Now, the Student Skin Consult is the one that has within it a course that we run for undergraduates. I've in fact been doing just some lectures for them over the last little while and recording those, and some of those are up there as well. But what I wanted you to do is for your pre-reading is just to look through that undergraduate course, look through some of the teaching things that are there, try and do one every couple of days, just spend a little bit of time doing it, and that'll give you excellent pre-reading for the diploma course itself. And the diploma course, though, is delivered through My Skin Consult. I'll give you access to this at the beginning of January. I've still got to clean up a few little bits and pieces from last year within it, but we'll get your access for that in the first week of January. To get into it, it'll be the same username and password that you have at the moment for Skin Consult and Student Skin Consult. So you put in your username and password, press enter, and it'll take you into the website. The website's laid out in this particular fashion. The two bits that are important are the bits that says ADD modules, which is where the modules for the course will be, and the virtual clinical meeting. We'll look at both of these just now. Let's look at the modules first. There are about 14 two-weekly modules. The course is delivered over a 28-week period. In week one of a module, you would tend to go over it, try and read through it just in a general sense, look at the images and the like that are there. Because on the Thursday of the first week of each module, we look over some MCQ questions that are going to be in there, and we chat about those, and we also chat about the module contents. In week two of each module, we go over, in the webinar, we go over some resource cases that are in there that you have to submit answers to, and I'll show you that in a minute. Let me first of all look at the layout. Now, some modules may have 2 bits in them, some may have 3, and I think one of them's got 4 bits in it. Generally, most of them just have 2 bits. Let's look at, say, the contact dermatitis one. This is the eczema and dermatitis one. The initial part of Module 2 is going to be on eczema and hand dermatitis. Module 2B is going to be on contact dermatitis and patch testing. And Module 2C is going to be on atopic dermatitis. Let's just go to that one first and have a little look at it, because it's the same layout in each of the modules. What happens is that you'll see it'll begin with a little bit about what we might be trying to teach you. I'll put some details in there. There's usually a little podcast initially, because when we set this up at first, it was initially we had mainly podcasts in there. We've just left them in there. You click on that and just listen to the podcast. It's in QuickTime, so if you've got a PC, you've got to download QuickTime. If you've got a Mac, you'll have QuickTime there. You have no problems listening to it anyway. Each module is divided up into about 10 parts, and there's a series of images and text in each part that's in fact there. At the beginning of each module, there's also a video. You should click and listen to that and look at that video. What that video does is it looks at all the images that are in that part of the module, and it describes them and it chats about them, so that you can get a lot more out of the images. You know, you'll look at the images with a much better eye if you've looked at them after listening to that video and looking at that video. The images themselves, they'll all enlarge. You basically click on them, they'll usually enlarge more than that. And if you want to move an image around, you hold down with your mouse on the left side of the mouse, and you just drag the image around. So you can place the image on a different part of the screen and read the bit of text that's there. You then click on it to get it back into position again. We try not to have a whole lot of material here. The material that I've written in there is material that you should pay attention to. We'll often give links to other little areas as well. I particularly use DermNet. DermNet's Amanda Oakley in the New Zealand Dermatology Society put together DermNet some years ago. And it's written at the level of a general practitioner. And it's written sensibly. And it's written very logically. And there are some good images and the like there as well. For instance, if let's have a little look at, let's just click on this link to the section on DermNet and atopic dermatitis. If I put a link in there, I want you to go and look at it. The thing about DermNet is it has some other good images in there as well. You'll be able to click on those and look at them. The text, as I say, is written at the level of an informed general practitioner. And so again, there's no point in me rewriting all the material that's there. So you go in and have a read of that material as well. It usually complements what we've in fact written. Then just click to go back. The other thing with the, and I should have mentioned this before, is the textbook that we use with the diploma course. It's Habif, the 5th edition of Clinical Dermatology. I've sent you out details of this already. I don't expect you to read Habif from cover to cover. There's about 700 pages in there. Habif is very good because it's got excellent images in there and some good tables that I'll refer you to as well. But it's mainly the images in a particular module that I want you to look over there as well, and the information that comes with them. You'll learn so much in dermatology by getting your eye into seeing things and seeing the finer points. That's what it's all about. It's a very visual specialty, and the best way isn't listening to someone talking about it. It's actually looking at images. That's why I have that video here at the beginning. By the way, with these videos, you can either view it at that size, but that would be too small. To view it full size, this little bit out here, you click on that little bit at the edge of the thing there, and it will then make it full screen. What I'd then advise you to do, though, is press the, press this to start it, then press this for full screen, and then press pause, and just let it sit at pause for maybe a minute or so, because it will then be downloading. You know, all these images, all these videos are done in high definition, and that means that there's a reasonable bit of megapixels involved in it. So you've got it, depending on how fast your internet connection is, it sometimes is a good idea to just press pause and let it download a bit first, so that it's not going to stop and start on you if you happen to have a slow internet connection. You've got a fast internet connection, fine, you don't need to worry at all. But that's how you look at the videos that are there. Now, you work your way down through the actual module. Sometimes I'll put other references here, like bleach baths for infected eczema. You'd click on that, and it would take you to an article that's there on bleach baths. Bleach baths are something that we're using a bit more in children who have, chronic infected eczema, like this kid here, who's erythrodermic virtually with a lot of secondary infection. Then bleach baths can be quite useful, and we'll chat about those in that section. When you come down to the bottom, you'll find there are a few other little resources that I give. If I give you a link there, go and have a look at it. It's there for a purpose. When you come to the end of the module, you can see there are some other little videos that are in there on that module on atopic dermatitis. But when you come to the end of the module, this is where you'll find your link to the MCQs that you have to do, say, for the first webinar that we're going to have on that particular module. You click here, and it will take you to the MCQs. I'll wait till that comes up in your page. So here were the MCQs for that, for this particular module on dermatitis. And I want you to have a chance to have gone over these before the actual first webinar on the Thursday night, the first week of a module. Let's look here and show you how we do it. Weeping of the skin is a feature of acute eczema. Well, indeed it is. Let's put true, because in acute eczema you've got spongiosis, you've got fluid in between the keratinocytes and the epidermis, and that bursts out onto the surface. And that's what gives you the little erosions that you can see. Well, at that level you can't, but the little erosions here in this kid with atopic eczema. So weeping is quite common. Oozing dermatitic skin is rarely secondarily infected. Well, that's false, because the skin is often secondarily infected in eczema. When you've got any oozing like that, you're going to get staph infection, almost certainly staph superinfection. So a whole lot of eczema tends to have staph superinfection associated with it. In chronic eczema, the skin is often thinned. In chronic eczema, when you've been rubbing the skin is usually thickened. It lichenifies. So the answer to that would be false. Much of what we see in eczema is secondary to scratching. That's in fact true. You see, in eczema, it's a defect of the barrier function of the skin. That little layer, the outer layer of the stratum corneum, is abnormal in kids with atopic eczema. They lack a molecule called ceramide, which is a fat molecule that is in the interstices between the keratin in the surface of the skin. And if they lack that, their skin the barrier function doesn't function normally. The skin dries out, dry skin becomes itchy skin, they rub and scratch, and so the various features of eczema come out. So much of what we see in eczema is secondary to scratching. That's true. And then chronic facial eczema in an infant may be a manifestation of food allergy. It may. In younger children, they can get a contact allergy to eggs or even to milk that comes on the cheeks. And so if you've got a kid that's not got a lot of eczema elsewhere, but has got quite a bit of chronic facial eczema, then consider food allergy as a possible cause. So that's true. So you go through each of the other sections like that as well, and then you press continue at the bottom here. And what will happen then is it will mark it for you. So there we go. So it will come up like this. Obviously, if you haven't put an answer in, it's not going to mark it for you. But we've got all those correct, so it gives me nice green ticks opposite each of them. If I'd got one of them wrong, I'd get a red cross there. So you get feedback straight away as to whether the answers were right. And if you've got a couple of wrong answers there, flick back into the module and look and find out what the correct answers would be. Okay? Because on that first, the first webinar of each module, the first week, we'll go over these MCQ questions, and I'll teach much the same as I taught there just now in the answers, but I'll also go over the module itself, and I'll highlight the main things that I want you to concentrate in the module too. And we'll spend a little time looking at some cases that you've put into the virtual clinical meeting. Now, let's just go back, because what do we do in the second webinar of each module? You know, the webinar in the second week. Well, what we do there is we go over your written online assessment cases, because for each module there are some cases that you have to answer and get into me before that second Thursday. Now, here are the cases for the eczema module. There's a series of little images here. We've just looked at that image here. You just click on that to enlarge it. You left click on your mouse to hold it down and move it down to one side, and you can have a look at the question there. How would you manage a child with this type of eczema behind the knees? Well, essentially, that's just showing you atopic eczema. There's the tiny wee erosions there where the spongiotic fluid has come out the surface. It's a red scaly disease, and you'll learn about the mnemonics that we use when we're diagnosing the red scaly diseases. So, you would write your answer in there. You don't have to write screeds. You know, if 5 or 6 lines will give me succinctly give me the information that I want, that's all you need to write. But what I'd suggest you do is that you actually open a Word document and put your answers in there first. Write them in the Word document first. The reason for doing, and then when you've done the 5 questions, then simply cut and paste your answer. So you cut and paste your answer from the Word document into there for question 1. Cut and paste from your Word document into question 2, and when you've cut and pasted into all of them, press submit. And then what happens is that automatically, your answers are automatically sent to me and to a particular area of the website under your name, when I can go in there, click on Module 2, which is what this is, resource questions, and all your answers will appear there, and then I can mark them, and I send out to you a little email with your grading as to whether it was A for excellent, B for very good, C for good, D for just passed, or F for fail. And we give you comments on your answers as well. But what I don't want you to do is perhaps, spend some time putting your answer here, spend some time putting your answer here, doing here, then going off for your tea or something like that, coming back an hour later and coming in, and then you'll suddenly find that this page may have been lost, because unfortunately the website is set up such that if there's no activity on a page for about an hour, then it will automatically flick out. It'll flick you off the website. So I warn you about that. It's much better if you put it on a Word document first and then cut and paste your answers into there and then send it to me. So that's what the MCQs for week 1, these little cases for week 2 of a module. What about the clinical meeting? How do you put some cases into the clinical meeting? Okay, these are some cases that are in there. There's, you can see there's almost 3,000 cases in this. They're set to archive after about 100 days. So we leave them in there for that length of time. Let's just have a look at a case that Graham put in here. Now, there's the history that Graham put in here initially. You don't need a lot. I just need a little bit of history of the particular case, what drugs the patient might be on, what relevant medical history the patient might have had. I don't need a whole lot of material. These are the images that Graham's put in. Let's just have a little look at this one. Slightly blurry this, but what he's pointing out is this white area that's coming along the side of this patient's tongue. And we'll just bring up the next one. Yeah, that's probably a better image. And you can see the white area along the side of the tongue here. And the question was, what's the cause of that particular area there? These were some of the comments that we put in about this. I wasn't sure quite what this particular lesion was, to be honest, and I think she needed a biopsy. The patient didn't really want to have a biopsy. Oral hairy leukoplakia is a condition that's sometimes associated with HIV. So this is why I think a biopsy and some tests are in fact necessary for this. I don't think it's leukoplakia as such, or a malignancy in the tongue, not like that. We seem to be having a little audio problem here just now. My apologies for that. Okay, I think that's improved a little bit there just now. My apologies for that audio problem there. How do you put a case up? Let's go back to the clinical meeting here, and I'll show you how you put a case up. See this little bit up here which says add a new case? You basically click on that. Now, your name will automatically come up at the top here because it recognizes who you are. You put the bit of text of the patient in here. You can either cut and paste it from other records that you might have of the patient, or you can just type it into this area in here. So let me just type something in here, just test and test. And ignore these two boxes underneath here. Now, how about putting your images in? You'd go to this little bit here about attaching pictures. Ignore what it says there about size. Go to choose file then go to wherever you keep your pictures, usually in My Pictures. Go to wherever the folder is that you happen to have your images. Let's just go to this particular folder here, and we'll open this up, and then go to wherever the image is that you want to put up. Let me just put this one up here. Oh no, let's go for this one here. This is a better one. You can see the size of this image is about 544 kilobytes. Okay, so I click on that, click on Open, and the image automatically comes up there. I can put a little bit of text underneath here, lesion on the breast. Then I go to my second image, click on this, go up and see where, it should take me back down where the other images were with this particular patient. This bit here. Click Open, it automatically comes up here, and we'll put a third one in just for fun. Let's go down to where it was, this one here. And that's all you need to do. You've put your bit of text in this box here. You've put your 3 images in here. Forget this bit about URLs. I'll put these in if it's an interesting case. I may want to put a reference in there, and I'll go in and I'll do that for you there. So when you've put your text in there, got your 3 images there, you just press Submit. And up will come. Now we just got to give it a little bit there. It's uploading. You can see down the bottom here, it tells me how far it's uploading. It's only, because I'm using a fair bit of wavelength bandwidth here, it's going to be a little bit slow to upload those 3 images. I'll just quietly talk here while it's doing it. The other little thing you'll find with your internet connections, usually your download speed is much, much faster than your upload speed. So you'll be able to download things much quicker than you can upload them. So if you happen to have taken images that are 10 megapixels in size, and you're trying to upload these to the website here, it's going to take you an absolute age. That's why I went over that business of resizing images right at the beginning there, either in ACDC or just doing a Snagit capture of your image, which automatically, as I said, will just make it 200 kilobytes. And that sort of image will be uploaded much, much faster. The other thing where ACDC and Snagit are useful is if ever we do teleconferencing, where you've got a case that you want me to do a video teleconference on. You know how nowadays the Australian government will pay a teleconferencing fee provided you're in the appropriate area, out with one of the main capital cities, and we can do a video teleconference. It's useful if you put up smaller images there. Okay, so it's now telling me it's been uploaded. It's giving me a case number for it, 2907. I'll just press OK here, and what should happen is it should be at the very top of that list. Here we go here. So we then just click here to open it, and up it will come. By the way, for for a case to come up, you have to have a bit of text up there. If you try just putting up images without text, it won't show. So you've just got to put a couple of bits of word of text up there, so that images will in fact show up. The individual image here, if I click on that, it will come up. This, by the way, was a case of mycosis fungoides. This is a T-cell lymphoma of the skin. It's red. You can hardly see scaling there. It's got slight cigarette paper wrinkling of the skin. You can see that fine little sort of ridging. That's cigarette paper thinning of the skin. And this is a T-cell infiltrate of the skin. It's a type of T-cell lymphoma. And it looks sometimes like psoriasis or sometimes even like fungal infections. And it's part of the mnemonic for the red scaly diseases. This was the same patient with some other lesions. Here, the area is a bit thickened. Here it's just a patch. Here there's a plaque because it's thickened and you can feel it. And if you're not aware of this condition, it can be a tough condition to actually diagnose clinically. Now, say I was wanting to add a comment on this case. You'll have put your text up there. If I want to add a comment to it, I just click Add Comment. Up comes a little box here, and let me just put something in. And then I just click Submit. And what will happen is that my text, what I've just said, will come up there. And the other thing that you'll notice, it puts my name afterwards because it knows who it is that's putting the comment in. Say I had made a mistake there and I wanted to change something. You'll see that Modify will come up under my comment. You can modify your own comment. I can't modify yours. No one else can modify yours. So if you had to modify your comment, you just click Modify. Up would come your comment, and you can go in there and change the spelling or add something else to it, and just press Submit again, and up it will come. You can also delete it if you wanted to. So what happens is I'll come in and comment on your case. You should go in and comment on other people's cases. If you've got something that you want to ask or you want to make the diagnosis yourself, you want to put your 2 pence worth in as to what the case might be, by all means go in and put your comments in there. And I actively encourage you to go in and comment on other people's cases. And it doesn't matter if what you put in there is subsequently wrong or anything like that. That's irrelevant. The important thing is I like to see you contributing. I like to see you thinking about the case and putting up what your suggestions might be. So that's how you add a case. That's how you comment on a case. And if I can just go back to the clinical meeting again, let me show you something else. You'll see here that underneath, when I put a case up, it'll say update this case. It allows me to update my own case. I can't update someone else's case. There's no update the case there. So I can't update someone else's, but I can update my own. So that means you can update your own case. Say later on that you've got additional information you want to put in the case, you just go and click update this case, and up will come the case again. There's your bit of text at the beginning. You can put in a bit of follow-up in here in that little box there. You can put the final diagnosis in there. If you don't put it in there, I'll ultimately put the final diagnosis in there because that's how the computer here stores it if I'm ever trying to look up the records of previous cases. And see here, you can actually go back in and you could change an image that's there. If you wanted to take that image out, you'd click Choose File and go and put another image, and it would replace that one there. Okay? Or you can add further images later on if the patient's recovered or something else has happened. You can click that to do so. And then again, you just go down the bottom and click Modify Record, and that will then upload the new material that you've put in. So that's the virtual clinical meeting. That's where you'll put in your 10 cases, because you have to put in 10 cases through the whole course, 5 in the first semester, 5 in the second. You could put in a lot more than that. If you've got a case that you need some help with, by all means, put it in there, and we'll come in and try and comment on it as well. So those are the main aspects of this particular website that I wanted us to have a little chat about. And the last thing I want to just chat about, by the way, the other things that are in here on the website you can look at later on. They're not really all that relevant to what we want to discuss tonight. Now, let's have a little look at the Learn Dermatology blog. This is the blog where we'll use in the second week of each module. We basically have this is the blog that we used in the second week of each module. We put a case up Monday to Thursday in the second week of each module. And what you do is you go in there and have a look at the case. Now, you can click on there to enlarge the image and click to go back. I shouldn't have done that. Just let it come back up again. Yeah. To make your comment, you go to this little bit here that says comments. Click on that. And up will come a comment section at the bottom here. What I want you to do is don't look at what other people have written. I know there's always a temptation, but you see other people may get it wrong. just go straight down to the comment section and enter your comment there as to what you think that particular rash was. And then just press publish, and it'll automatically come up like this. So for instance, if I just put test comment in here, and press publish, then it should automatically, there we go, it'll automatically come up here. It'll be the last comment on that list. So it's pretty straightforward to put a comment in about the case. The question here was, what mnemonic would you use to analyze this rash? It's actually, if we enlarge that again, it's a red scaly rash, so it's the PM's pet that you would use. What's the likeliest diagnosis, and give some differentials. And these are the comments that various people have put in. Monica had no problems with it. It's a red scaly rash used in the mnemonic PM's petal, PM's pet. Monica's obviously looked at the Student Skin Consult pre-reading one that we've put up, and she's put in what the differentials are, and she says that this is probably pityriasis rosea, which is what it is. That's a viral condition, usually has a herald patch, and then you get these oval scaly lesions along the lines of the ribs. So the cases that are up in the blog, the blog only runs in the second week of each module, from the Monday through to the Thursday. And at the end, I put the case up the night before. You go in and put your comments in there. And at the end of the day, there's a little video that will come up where I go over the case and comment on some of your comments as well. I may come in and put something in on some of your comments during the day anyway. It may be difficult, to try and get into every case. I know you're busy at work and what have you, but if you can try and get into 2 of them out the 4 that are going to run in the second week of each module, then that's good. There's additional material in there. We try and emphasize some of the things that we're trying to get across in that particular module with the cases that we put up here in the blog. You'll get into the swing of it. It may seem that there seems to be an awful lot at once, but you'll honestly get into the swing of this once we get started. So that's the Learn Dermatology blog. Okay, I think I've probably spoken enough tonight. We're a wee bit over time. Any questions from anybody there on either the virtual clinical meeting, putting cases? Syed, you put your hand up. Let me see if we've got that working, and then I'll come to Donald after that. Syed.
I wonder if you hear my voice now.
Excellent. Yep, I can hear it beautifully. What was the problem before?
That's the problem. I actually didn't set my headset correctly. This is the problem.
Look, no problems at all. Where are you based, Syed?
I'm working as a general practitioner in UAE since 2007.
Whereabout? Where did you say you were?
GP practice. I'm working in GP practice in UAE.
NYE?
United Arab Emirates.
Ah, so look, my apologies. I do apologize.
No.
I didn't quite pick up where you were there. I was trying to think now. Where is that? So whereabouts is United Arab Emirates? I'm showing my ignorance of my geography. Is that Abu Dhabi?
Yeah, Abu Dhabi, Al Ain city. It is part of Abu Dhabi.
Ah, right. Okay, excellent. No, look, the audio is fine. There's no problems. What time of day is it over there just now, or time of night?
Now it's 5 afternoon.
Afternoon. Okay, well, that's not too bad.
3-5.
Okay, look, that's great. I'm glad you were able to get a chance to chat. That was good. And it's nice and clear there, so you've got that set up beautifully. Okay, thank you very much for that. Cheers. Now, just a couple of questions. Donald, let me come to you. Yeah, Donald.
Ian, hi. Just that I found that the writing to log into the blog site with the Google codes, that the handwriting was worse than mine even, and I had to try about 2 or 3 times to make it out, My wife she was able to point out what it was, I don't know if anybody else has the same difficulty, or is there any way of rectifying that?
No, you see, that bit That's Google themselves. They do that it's to stop computers. They must have trouble with other computers automatically.
It was to tell whether I was a robot or not, you know?
That's right. That's exactly right. That's what it's for. Yeah, look, I sometimes have to do it if I'm doing a new one. I sometimes have to do it about 4 or 5 times before I actually manage to.
So it wasn't unusual.
No, it's not unusual at all that you might have difficulty just registering for a Google. If you've got a Gmail account, then that's fine. You don't need to register for anything. But if you don't if you're not registered with Google, you've got to register to be able to access.
So is it better to go to the Gmail? Is it better to go Gmail? Because I did register for a Gmail account. Is that easier or better?
Yeah. Well, normally if you've got a Gmail account, then if you use that, your username and password for that, the first time to get in, it'll automatically allow you in after that. There shouldn't be any problems. Yeah, you might find that's the easier way to do it.
Is there any way I can experiment with that at all?
Yeah, just play around. Just go and play around. Doesn't matter what you put in there. This one here is just a demonstration one, so you can put in anything you want.
Yeah.
And
okay, I'll try
around with it. Okay, no worries at all.
That's great. Thanks, man. Thanks.
Cheers. Any other questions from anyone? Abbas, you've still got your hand up, but I'm not sure if that was from before. I'll come to you again anyway. Let me just unmute you. If I can. Nope, doesn't seem as if I can. No, sorry, I'm having a wee bit of trouble trying to unmute you. Okay, look, I might leave it at that then tonight. If there's any other issues, send me a little email. I'll send you out a copy of this particular webinar anyway. I think I sent you all a copy of the first one. If there's some aspects of this you want to just go over at your leisure, then you'll be able to do that with the video copy. I'll be having, I think, one more of these sometime in December. You're welcome to come back to a second one. I basically go over much the same thing as I've done tonight, though I may change the examples a bit. But as I say, you can come to another practice one as you wish. But try and go to the Students Can Consult, try and have a look through the undergraduate course there, work through the little test cases that are there, and it will set you up nicely for the start of the diploma itself. Okay, thank you very much for tonight. And I'll see you either in 2 weeks or later when we start the course. Bye-bye.